Yeah, thank you, Prof. Thank you for chairing the session. Thank you, Prof. Zarina, for inviting me here. First of all, I would like to welcome all our new orang kata keluarga fakulti perubatan. Yeah, is actually a starting or a beginning of a new phase in your life, which is not really a bed of roses, tapi at the end of the day, I'm sure, inshallah, it will be a lot of benefit to you. So before that, I just share my screen sekejap. Okay, Prof, boleh nampak saya punya slide ya. So today we are going to talk about health advocacy. For me, this is also a new thing, but when I do some research, because this is not erectile dysfunction or premature ejaculation where normally I talk about, so I need to read a bit about health advocacy. Tapi rupa-rupanya actually this thing we are doing it every day tau. And then these are the thing that like Prof. Zarina said just now is all about communication sebenarnya. Okay, just hang on. Right. Okay. So what is actually health advocacy? Kalau kita tengok dekat slide kan, when I actually asked somebody about this, and this is actually his word. Yeah. So I said, what is advocacy? So he said, advocacy is actually there's no big deal about it. It is actually just working with people and then simply utilizing good interpersonal skill. We have heard from Prof. Zarina just now about communication skill, and we know that communication skill is actually part of good interpersonal skill. Tapi kalau kita nak tengok what is actually the makna of advocacy is actually the act of taking position on an issue. Yeah, and after that we initiate action in a deliberate attempt to influence private or public policy choices. So this is a big bombastic word lah, tapi sebenarnya is actually a good interpersonal skill and being a orang kata health advocate, which I'm going to talk about after this. And we have to understand that advocacy is actually a process and it is not an event. And we can use advocacy to promote almost any issue. And as you know, in health, there is a lot of issue that we can talk about. Okay, sebelum pada tu, let me explain a bit about this. This is a concept that we want nowadays. Yeah? In 2020, this is the thing that we wanted. We want a patient-centered care. Yeah. So what is patient-centered care? So patient-centered care is actually a healthcare that establish a partnership between practitioner, patient, their family, because we want to ensure that decision respect what patient want, what patient need, and what patient preference. It's not about what we need anymore. It's about what patient want and their relative wants. And patient have the education, I put that in red, education, and support their need to make decision and participate in their own care. So this is the new patient-centered care that we wanted. Education, why I put that education? Because patient education is actually our education. We are the one who's going to educate the patient. And patient-centered care, safer medical system, and greater patient involvement in healthcare delivery and design are the goal of health advocacy. Okay, then I will talk a bit about siapa to actually health advocate. We ask ourselves, who actually health advocate? Health advocate is actually kita sebenarnya. Saya, ya, Prof. Azhar, Prof. Zarina, and you guys, and you all. Because we are the one who are the individual who provide direct and personalized service to a patient and their family as they navigate throughout the healthcare system. So we are actually the health advocate. Nak, we are the one. And we need to engage in activity that promote health and access to healthcare in community and larger public. But I just want to sort of like discuss a bit about activity. This activity are not actually macam we go and promote macam pink ribbon lah, blue ribbon for prostate cancer and all that. These are the activity that we do every day. I will elaborate a bit more about this. And then we are not talking about big thing now. We are talking about the things that we can do in our environment. Okay, coming back to the term of health advocacy, what is actually advocacy? It is also called health activism. Okay, tapi kalau you tengok definition ni, it's a bit long-winded lah, but I will read it out to you. This is sort of like what is the meaning of health advocacy. It is encompass a direct service to individual or family, as well as activity that promote health and access to healthcare in community and larger public. Yeah, meaning that health activity, healthcare, and advocates. The health advocates support and promote the right of the patient in the health arena, which help to build capacity to improve community health and enhance health policy initiative focus on available, safe, and quality care. So it's a bit mouthful, but it is actually an important statement of our role. So a health advocate, again, we are health advocate, are best suited to address the challenge of patient-centered in our complex healthcare system. For example, nowadays, kan, it is not like last time when I first started our medical career, macam, yelah, I Prosarina and all that. At that time, there's no Google. There's no Dr. Google. At this moment, patient comes to you with a lot of knowledge from Dr. Google, and they challenge us sometimes. So these are the things that we have to face nowadays. And sometimes they come with papers and all that. I'm trying to argue with you, but still, we are a health advocate. So you might think, okay, I baru first year, maybe it's not, I'm not ready lah yet to be health advocate. Actually, no. So actually, everybody now is a health advocate. So once you dah masuk to become a medical doctor or nurses or practitioner, you are the health advocate. So according to me, according to me lah kan, this is actually the approach of how you want to become a good health advocate. First, you need to recognize your power. And of course, you are actually powerful because you are the expert in your field. You are now going to become a specialist in your field, later going to become consultant in your field. And then you have to see yourself to be the resources. And then, of course, you have consultant, you have your what you call specialist, engage with them, discuss with them. That is what I put there as engage the decision maker. And of course, if you want to share about public, kan, about something that you know, about something that you will share with the public, utilize the media. I will go one by one. Okay, be the resources that build the power of the community. Community here, I'm not talking about community at large, you know. We are not politician. Community ni maknanya community, your community. Your community maksudnya your family, your nurses, your houseman, your pembantu kesihatan, the community around you. So I put there, advocacy is much more effective when supported by engaged community. So meaning that you have to educate your community dulu. You need to share the knowledge with your own community first. Change the culture and attitude of the community from within. So maknanya kalau dulu you are at certain hospital, now you come to another hospital, you rasa there's something good that need to be shared from that hospital to this new hospital. So try to change your culture and attitude of your community from within. And engage your member in the issue as well as process to develop a collective beneficial agenda. So maknanya if you feel like macam katakan Allah lambatnya buat discharge dekat ward ni, patient berlambat-lambat tengah tunggu, try to discuss, give some idea, tanya nurses, tanya the pembantu kesihatan, sit down together to formulate what we are going to do to speed up the discharges. So that is actually health advocacy. And you can see from the slide, I put there, make advocate out of every member of the community. So you have to make them feel that they are important. Even though they are like just a cleaner in your ward lah katakan, tapi you need to make them important because you need to know that, okay, you need to clean this area very fast. Kalau patient ada spillover ke apa ke, you need to educate them and empower the community with knowledge and skill. So share your knowledge, share your skill with all your member. And then Prof. Zarina tadi been talking about communication. So communicate effectively with your member, with your patient. And then I put there the last statement there, every member of the community is a potential seed that you can be grown. Even your houseman, you can grow them. You janganlah asyik nak marah dia orang je, memang IP buta macam tu kan. It's actually you are the one who have to teach them. And then with the right guidance and all that, they are actually the potential seed that can be grown. And then, okay, I bukan nak tunjuk I masuk TV, Prof, tapi actually this is actually one of the newer to utilize the media. Ya, maknanya these are the newer version to share the knowledge, to advocate the knowledge as a health advocacy. So you can increase public awareness. If you like to talk about something, you don't have to go to TV, to 3v3 and all that. You have a lot of channel. You have Facebook, you have Twitter, you have YouTube, you have Instagram to share. So actually this is one of the, I think for me kan, macam you educate public and all that is actually one of the good distress mechanism kan. Kalau you feel that you have an issue you want to share, please share it in Twitter, YouTube, Instagram. And this is the actually now the platform that you can educate people indirectly. So enlist public sentiment to support a desired change. And then, okay, this is actually my last slide, Prof. So you have to remember, you rasa you might be small, but actually you are mighty. So advocacy should be the driving force of all your activity and interaction. You have to recognize, like I said just now, that you may already engage in some or all these activities. And your activity, to be nice, it should be packaged and delivered with clear vision, commitment, and intention rooted in advocacy. And I just want to quote what Margaret Mead said, is that never doubt a group of small, thoughtful, committed citizens can change the world. And indeed, it's the only thing that ever has. Thank you very much, Prof.